And the last piece is, and you'll notice throughout, particularly the regulatory language, we were really purposeful and really careful to change a lot of the language. We wanted to make sure that the language that families see, that the public sees, is inclusive and accessible. You'll notice that we changed some of the terms from things like subsidy administrator to family access coordinator, and other terms of art that may seem small in the micro, but when you look at them at large, I think really signal to the direction the agency is going, which is to be more parent focused, more child focused, more family friendly, and also just more consistent and updated with language that's in the nomenclature that is used now. So that's a high level look at the first bucket. I will turn it back over to Joy to talk about the second part of the regulations.
Thank you, Rob. So the second part, as we mentioned briefly, was really thinking intentionally about how we can put the needs and experiences of families first as we think through the processes, policies, and regulations. So for example, building in more opportunities to support families who are navigating the system, both at the beginning of the experience and all the way through, so that families can understand what to expect and have all of the information that they need to be able to make informed decisions on behalf of themselves and their children throughout the time that they're with us. And to really think about how can we alleviate the burden on families, in addition to the ways that Rob mentioned, just thinking about what are we asking families to do or to submit, and is that in and of itself a burden for families, and how can we make some changes that can alleviate those burdens. Really looking at our timelines and making sure that the timelines reflect an effort to provide stability or continuity of care for children and families. And then to think about how can we reduce some of the rigidity that Rob mentioned without compromising our responsibility to the federal law that we are responsible of abiding to. So a lot more to share on this side, but really family-centered approach is the heart of what we've tried to do here. And back to you, Rob.
Great, thank you, Joy. And then the last real bucket, or thematic bucket, if you will, is that we really took a close look at and approach to, is to really modernize and update the system. So there are a lot of different agencies and partner state agencies that we work with, whether it's the Department of Transitional Assistance or the Department of Children and Families, and others as well. We really taking a close look and continue to take a close look at those alignments, areas where, kind of alluding to before about duplicative requirements, where if another agency is already providing verification of necessary things like income or things of that nature, where we can align with them and not have to repeat those processes. And at the same time, working to ensure that folks that are in a more vulnerable position, that may be involved with the Department of Children and Families, can access care as quickly as possible through our referral system. Similar, in a similar vein, strengthening those partnerships with childcare involved agencies. We want our processes to be efficient. We want also for those agencies and those providers and administrators to be able to work with us and not be confused by what may be contradictory or confusing regulations and policies. And the last is, as many of you know, at the beginning of the pandemic and through the height of it, there were a number of flexibilities that were put in place for the childcare system due to the heightened COVID-19 pandemic. And we've been looking at those and deciding which ones to retain, which ones to modify. And some examples may be extending provisional authorizations for individuals and parents that may be eligible but are seeking an approved work activity or in a job search or working to enroll in classes or something along those lines, to extend those flexibilities to parents to recognize that people are at many different points in their life and what's going on. And even though, one of the few, I think, good things about COVID was it allowed us to take some flexibilities with the system. We want to retain those ones that make sense for families moving forward as well. I'm going to turn it back to Joy now.
Great. Thank you, Rob. So next steps. looking at the whole process from approval to promulgation to implementation. Right now, we are at the STAR, February 16th. We're here to hear from you, and note that we're really taking this opportunity to learn from you and hear you and inform the work that we're going to do to take these regs to the next level with your ideas and your feedback. February 17th, tomorrow, will end the public comment period. And then on March 14th, we will go to the board to review the public comment and potentially vote on regulations for promulgation. March to April, looking at finalizing all of there's a lot of work still to do on policies and procedures to make sure that they are adequately supporting the revisions to the regulations. And then around May and June, we're anticipating being able to roll out those policies and procedures to the field, including trainings, support materials, and then anticipating July 1st for an effective date of our regulations and policies. So that's what we're thinking on our timeline right now. And with that, I'm going to hand it back to Eugenia. Thank you.
Thank you, Joy, and thank you, Rob. So now that is all you'll hear from EAC other than me calling on all of you. We're really excited to hear your comments, hear your feedback, like the commissioner said, where we got it right, where we need to go further, what things we might not have thought of. So if you'd like to share your public comment, you can go down to the bottom of the screen, and in the reaction space, you can click on that and raise your hand. We'll call on folks in order. The one exception is I will be checking with our friends who are interpreting to see if there's anyone who's accessing interpretation services, and I may call them out of line to get folks in. So we'll get going with that. First, I'll check in with our Spanish interpreters to see if there's someone who is listening in Spanish who would like to share their comments. Okay, we'll come back, we'll check again later on. And then for folks who are working with our ASL interpreters, if any of you would like to notice that you would like to share some comments, we're happy to hear from you now as well. We'll give a moment and then we'll just start calling down the line.
Yeah, I don't see anyone, Eugenia, and I expect them to probably do the same process with the hand up. And then if they just start signing, I'll just start interpreting for them.
Beautiful. Thank you, Carrie.
Great. No worries.
All right, Maria, we'd love to hear from you. You can go off mute.
Hello. Hello.
We can hear you, Maria. Thank you.
I'm Maria. I had four concerns about the early childhood education. I started working for this program about 1.5 years after the pandemic. Then I come in as I used to be a teacher for 25 years. Then I had to start the process like anybody else, anybody who doesn't have a high school diploma. And that was fine. I started from step 1, taking my courses and all of that. But at the same time, when it comes to be an administrator, I am not an administrator because I don't have the EEC requirements, which send me back to the first grade level in the EEC program. Then I found that needed to be changed because I was a high school teacher. I was an elementary school teacher and a high school teacher. I was missing the pieces of early education. That's fine. I will go back to review and start with that. But as a master's degree person, I don't get to be qualified, not different from somebody who just have a high school diploma. There's something needed to be worked on that, because I don't think it's fair that I have to go all the way back to begin. My second idea is that a lot of kids are going home after school. They're not going to somebody to take care of them because parents cannot afford to pay. I have a parent that she has the children in private school, and then she has to pay an amount of money for the kids to have, even though that she has a voucher, she has to pay the agency money to be able to have her kids after school in a safety place. Then a lot of parents are not doing that. Kids are going home. They're not learning much. They just sitting at home because of the money that the parents have to pay to be part of any agency, even though that they get a voucher. My last concern is that when we do all the certificates required, all the webinars that I've been doing, if I do it with the South, if I do it with the North, there is a time when the person that sent the certificate, I don't have contact with them because that person was not the person who did the webinar. Somebody else sent the certificate. If you don't get it on time, you lost that certificate. I've been losing about 25 certificates because when they send it, it's not the same person as the teacher that I had. I don't know if you understand my piece, but you know, those are the things that I have a lot of concern with this, with the EEC program. I'm very happy to be an educator, but you know, all of these changes, I would like to see them.
Thank you, Maria. And thank you for your service as an educator. Just a reminder to folks that this public forum is to hear about the regulations that were proposed around the Child Care Financial Assistance System. So we love to hear about that. Other issues, please feel free to send a message to one of the EEC folks in the staff, one of the EEC co-hosts, and we're happy to get back to you at a different time. Ruthie, you can go ahead, and please remember that we have interpreters, so if you can speak a little slower than normal, we'd appreciate it.
Okay, thank you. Commissioner Kershaw and board members, my name is Ruthie Lieberman, and I thank you for the opportunity to submit comments on the Department of Early Education and Care's proposed regulation changes. Economic Mobility Pathways, or EMPATH, is an organization dedicated to moving families out of poverty, as well as providing other organizations with the tools to do the same. As an anti-poverty organization, EMPATH supports families in facing many barriers. For many of the families we work with, subsidized childcare is vital to making progress towards economic stability. There's a whole host of proposed changes that we believe will improve access for our parents, and we thank the EEC for all of those changes that have been described. And some of the ones that we're most grateful about is the removal of the 2-year limit on childcare based on homelessness, waiving parent fees for those who are homeless, adding domestic violence as a service need, and increased notifications for when eligibility periods are ended. Thank you, EEC, for these changes. We do have a few concerns that we want to share today. The first area is about various limits on education and training. The proposed regulations do not specify how EEC will calculate the number of childcare hours that are granted to parents who are in school. Without the current language that specifies additional time for homework, parents may not receive enough hours of care. This will certainly impact parents' ability to successfully complete their education or training programs. We urge the EEC to once again include language guaranteeing homework and prep time coverage for parents who are students. The proposed regulations also give EEC the discretion to decide which education and training programs are considered approved without outlining the criteria in advance. Our staff work hard with families to help them as they navigate starting various training programs and accessing childcare. It would make the whole process so much more challenging if the parents did all of that work only to be told that their program wasn't approved based on EEC's determination, and that these criteria were not outlined ahead of time or clear to the parents. Another area of concern is about reporting requirements. The proposed regulations make the reporting requirements more stringent than the federal rules by requiring parents to report changes that don't impact eligibility within a 12-month period. Parents could end up losing their childcare for failure to report a change like the birth of a baby. This may not have been the intent, but we would like to see these regulations clarified to ensure that unnecessary reporting requirements are not added. The next area is around penalizing parents who can't afford fees. The proposed regulations allow EEC to end support for parents who fall behind on fees, regardless of the reason why. This penalty would pose a detrimental setback for families and actually prevent many of them from being able to work. And working is what allows them to pay their fees on time. We would like to see regulations requiring providers to offer reasonable repayment plans and allow families to continue to receive care while they are making their late payments. And finally, I want to talk about parents' right to appeals. The proposed regulation would limit parents' rights to appeal, particularly in situations where they were said to have failed to submit documents on time. We often see issues where families have submitted documents, and for a variety of reasons, one of them being staffing changes, those documents are not entered into the records. We're concerned that miscommunication and staffing issues could impact documentation, and parents would not have the right to make appeals around their care. So we urge you to preserve parents' rights to appeal. Thank you so much for your diligent work creating these proposals. We hope you will adopt the suggestions that we've provided in order to ensure that low-income families continue to have access to vital childcare assistance. Thanks.
Thank you, Ruthie. We'll call on Sarah next. And for those of you who would like to provide comment, as a reminder, you can raise your hand down at the lower section of your screen in the reactions space. Thank you, Sarah. You can go ahead.
Good morning. Thank you for the opportunity to comment today. My name is Sarah Levy, and I'm a senior attorney at Greater Boston Legal Services, where we represent low-income families who rely on child care subsidies. Our clients include clients who are working, transitioning from TFDC, clients who are homeless, dealing with domestic violence, clients with disabilities, clients who don't speak English, and clients who are very newly arrived in the United States. I think the most important thing I want to say today is thank you. Thank you for the new direction that EEC is going in to prioritize access for families and to streamline and modernize subsidy administration. It's not only fantastic, it is going to change my clients' lives, so thank you. Greater Boston Legal Services has done a very close review of the proposed regulations, comparing them to current and prior regulations, as well as applicable state and federal law, and we'll be submitting very detailed comments. But I do want to highlight today one section that's particularly important, and that is that we have done a close review of the Child Care Development Block Grant requirements in statute and regulations. And what we find from that review is that it not only enables EEC to go further, in some circumstances, it requires it to go further in terms of easing subsidy administration, particularly as it relates to temporary changes, as Ruthie Lieberman also addressed, denials and terminations, and allegations of intentional program violations and fraud. We look forward to partnering with EEC on changes to the regulation and to supporting families as we move forward. Thank you.
Thank you, Sarah. We welcome more comments. There's a lot of you on. I'd love to see some more hands and hear more of your thoughts, feedback on the work that's going on. And thank you for those who've commented already. to share comments as a quick reminder, all you need to do is scroll down to the bottom of your screen, you mouse over, and in the reaction space, you can use that to raise your hand. Wonderful. All right, Kim, thank you. I'd love to hear from you.
Hi, good morning. What a great turnout today. Kudos to you all for getting the word out to the field and for so many people for joining. The Mass DCR&R network has also submitted detailed, lengthy comment in writing to you folks. But on behalf of my own agency, I would like to just discuss the secondary approval process for a minute. And in your presentation, you talked about duplicative documentation and things that had already maybe been looked at by somebody else. When it comes to receiving a DTA referral or a DCF referral, those are other state agencies that are authorizing children for care. And right now, subsidy administrators are required to do that secondary audit on every authorization, including those with those referrals. It's one of those areas where we feel that pain point. It slows things up. It requires 2 appointments for all of those families. And while I'm all for auditing and having things as accurate as possible, where other agencies are authorizing the care, the errors that we find might be a wrong phone number or a transposed street address, things that can easily be corrected and should not be holding families up in their quest to get care quickly. Thank you.
Thank you, Kim. Thank you for sharing your comments. Love to hear from more of you. Again, all you need to do to share your comment is raise your hand, and we would be thrilled to call on you and hear from you. Sunny, go ahead.
Hi, thank you. My name is Sunny Daly, and I'm further away from this than most of you. I work at the Community Foundation for Nantucket, and we do a lot of convening around the critical needs on our island, one of which is childcare. I think there are a lot of misunderstandings about who is Nantucket. Usually people just think we're a wealthy island that's here for summer people. Our most recent census says there's 1,400 residents, but our water and sewer usage indicates there's closer to 25,000. We have 1,600 students in the Nantucket Public Schools, 16% of which are English language learners, which compares to only 10% statewide. We have 30% that are deemed economically disadvantaged and 52% of whom are high needs. Couple that with the cost of living on Nantucket, which the national average ranks us 257 compared to a Massachusetts rating of 127. So we have a lot of families that are living on the edge because of all of these pressures. We also have a very low percentage of childcare providers on the island. And in fact, there is only one licensed care provider for infants on Nantucket, and the classroom size is 3. Couple that with a birth rate of 150 on island, it means there are a lot of families going without childcare. That we're seeing trickle into things like kindergarten readiness, where we have a majority of the children coming into kindergarten who need additional support. I am begging you to look at Nantucket as the unique situation it is and think about ways to first outreach to our community, because I know the voucher program is very underutilized. We don't have a SNAP office on island, but we do have a WIC office. We don't have a lot of the support services that folks here are representing, but we do have a domestic violence shelter. There are a lot of ways that I think Nantucket needs the support that is being offered through this voucher program. The other part, though, may be consideration for the cost of living and what the voucher may cover for teachers. There is a huge gap there. I have heard from teachers they don't want to accept vouchers because they're losing money by doing so. Again, we really have to think about the children that this affects and how we can help close the gap so that they are assured safe, childcare options so that their parents can do all the things they need to do in order to provide a safe and healthy life. So I thank you for considering the unique needs of the Nantucket Island community.
Thank you for sharing your comment. Still looking for more comments for you. So again, just raise your hand if you'd like to share your comments with us. I also like to take a moment to acknowledge, I'm not sure when she joined in, but probably while I was looking at the chat, admitting people and sharing some of the logistics, but our board member, Maria Moeller, who is a wonderful advocate and has worked in the field for a long time, has joined us. So thank you so much for joining us and listening to this public comment with all of us. We really appreciate it. Donna, you can go ahead. Donna, you're on mute.
There we go. Good morning, everyone. I'd like to take an opportunity to touch on three different aspects of the red line version of the changes. The first one would have to do with the definition of full-time service need and full-time childcare attendance. I think that reducing the service need to 25 or more hours per week will be tremendous help to a lot of families. But more importantly, I think it will provide an opportunity for a lot more continuity of care for children. The definition of full-time childcare attendance is the thing I really wanted to focus on. What we're seeing here in our program is many children that for various reasons are being having a difficult time finding wraparound care. Specifically, we have a lot of children in our program with special needs diagnosis that require services through the public schools or ABA programs. But it limits their ability to attend care for a minimum of 6 hours a day or 30 hours per week. But the lack of programs that are offering part-time childcare often means that families need to choose between keeping their child enrolled in childcare or getting their child the special needs services that they require, and limits the parent's ability to work if they lose childcare. Many of our family childcare providers, they lose money if a child is only qualified for part-time enrollment based on the number of hours they attend in their program, and they're not willing to sacrifice pay to continue to service these children on a part-time basis. So reducing their attendance to 25 hours in the week would allow us to service these children as full-time children and provide continuity so that they can get their services through outside sources and then have the wraparound childcare programs that would enable parents to continue to work. So that's my first comment. My second one is more of a question. Will there be an opportunity for those of us in the field to comment on the policy and procedure revisions that will go along with these regulation changes? So we would hope for an opportunity to see how we're going to have to implement some of these changes and what that's going to mean for those of us making these determinations. And my third comment is about self-employment. We would like to strongly suggest that family access administrators not be responsible for making eligibility determinations for self-employed individuals, and instead recommend that EEC either appoint or provide highly trained specialists, perhaps maybe through the 5 regional CCR&Rs, to handle all self-employment cases. There are so many kinds of self-employment situations We feel our program staff lack the training to make accurate subsidy determinations, eligibility determinations, and counsel families on what documentation they need to provide in each self-employment situation. Our staff have spent literal hours working with self-employed families to complete the monthly worksheets and explaining to them what documentation is required and what is considered a qualified expense, and the minimum wage requirements, and all that goes into qualifying self-employed individuals. And we've had quite a number of families actually give up the opportunity for the child care subsidy when we contact them from the wait list, because they get very frustrated, or they don't understand what is required for them to provide around documentation for self-employment. The other thing is we also fear EEC audits and finding out that those families that we have qualified for subsidies, that somehow we've done them incorrectly. So thank you.
Thank you so much for your comments, Donna. We're not answering questions today, but I will quickly just reiterate some of the things that Joy had said earlier. So this is an ongoing process for us, and we will be back in touch, and there will be other opportunities to engage with us on this work. So we're looking forward to doing that. I would like to give an opportunity. We had a comment in the chat that was translated to pop in on our folks who are listening to Spanish interpretation, to see if Miriam would like to share her comment. We'll give a moment. And if you would like to, Miriam, you'll be on deck after Karen. So Karen, you can go ahead and share your comment. Thank you.
Hi, everyone. My name is Karen Pierre-Louis. And first, I want to thank you for this opportunity to be able to share. I think these spaces are rare sometimes, so I definitely want to say thank you. And I also wanted to thank Joy. It's nice to see her in person. I had reached out to her, I think maybe sometime last year, and I just wanted to advocate so there could be changes on the current policies for service need. I think initially grad school and nursing students were excluded from a service need, and that was my situation. So you know, I wrote like a very long email just advocating on, you know, I'm trying to be lifted out of poverty, and without this help, I wouldn't be able to. But also, I think I really appreciate that there will be changes to how the information is available, because even, you know, to find out, I had to do a lot of research, and I was trying to see, okay, well, if I can't qualify here, then can potentially I qualify, because I've had a lot of mental health challenges with the loss of my little brother, among many other stressors in life. So I think I just wanted, if like one of the things that would make it more accessible for parents that are, in order to, it seems like, to qualify for not being able to, I guess, fully care for your child, you have to be considered disabled. And I think that unfortunately we continue to see that there, you know, there's not enough mental health access. That's a whole other thing. But caregivers that are not able to fully care for their children in the ways that they want, having a voucher could really eliminate a lot of the stressors and just provide a better life for the kids. And also, I just wanted to say, I don't know what kind of the logic is with the pay that goes for the children. So my son turned 2 last month, and you know, I helped his daycare teacher with some of the paperwork because language is a barrier for her. And I noticed that the daily rate goes down $10. And I said to myself, well, that doesn't really make any sense. I mean, his care is not any different. Like, he still requires a lot. And, she's still taking a pay cut by accepting the voucher because her daily rate is $70 a day. So I think just also consideration, as someone else said earlier, I think, while it is a great help, I think there's a lot of daycares that are still not accessible because of the price that is paid, but also I think the voucher process is just, it's a lot. And then lastly, I would just like to consider, like, I still, although I've gone through the policy documents quite a few times, it's not very clear to me if children that don't have a documented status qualify for care. And I think if, again, it's not clear, but if they are not, like, I really wish that would be reconsidered. I'm sure funding is the biggest thing, but I think there's just more and more children impacted by poverty, and parents, like, forget about having to choose, can my child go to an after school? There's parents that have to choose, can I pay my rent this time, or will I be able to buy an appropriate grocery, like nutritional meal? So I think inflation is impacting all of us, and I would just like to say that I hope that there are some considerations to making additional changes. But I'm really thankful for this place. Oh yeah, and I'm sorry, one last thing. The engagement portal, I was following that pretty closely because I kept trying to find these places where I could, advocate for this need, but the website isn't working now. But in general, like, all these changes are great. I just would like to also push and say, I hope that this information is shared on social media in places that are easy to share, because people, that share my identity, Latina, or communities of color, a lot of times are excluded from these things because it's hard to find this information. So just making the information more accessible and truly invite people's voices to be part of this. So thank you again, and have a great day.
Thank you, Karen. Thank you for sharing your comments and your experience with us. Again, we're welcome more comments. If you would like to share, you can hover in the bottom and use the reactions symbol to raise your hand, and we'd be happy to call and hear from you. Laura, you can go ahead. Thank you.
Hi. I noticed that parental visits would also be excluded from the amount of care that children can receive. I just wanted to comment that those are often unreliable. So they often don't happen. I think excluding children from care on, days that they're supposed to have parental visits, and not paying providers, oftentimes children do need the care on that day because for whatever reason, the parents aren't following through with their visits. So that's just a comment I wanted to make. And also, I saw the changes for the documentation of ID. There were some changes in that. Is there a place where I can get more information about what specifically those documents would be?
Thank you, Laura. We'll share some comments after this meeting and see if there are things that we can share on that. Thank you. The nice thing about a Zoom registration is we can email you all afterwards. Other folks with questions? Sorry, not questions, who have comments for us who'd like to share? And a quick reminder, to share your comments, all you need to do is raise your hand in the reactions section. We'd love to hear from you. I'd like to remind you all too that we're still accepting written comments. We'll be doing that until end of day tomorrow. We would really love to get your comments in writing or today on this call. However, you feel most comfortable sharing your feedback with us. This video, the chat, and any emails that we get throughout the public comment period will be gathered together by our team. We'll look through them and we'll use those going forward. So your comments are very important to us. Christian just put in the chat how you can share public comment, and we'll be taking public comment in writing till tomorrow at the end of the day. So please feel free to share in writing as well, even if you already shared your comments today. And we'll be here too. So if you would like to raise your hand, I'm happy to call on you and hear from you. Brianna, go ahead.
Hello, good morning. My name is Brianna Flannery, and I'm the W Director at For Kids Only After School. We just wanted to truly thank EEC for taking the time to do this work and for so many positive changes that we see in these regulations that will support families in this process. A few to note: policies around service need hours, homelessness, domestic violence, parental leave, education training, allowing grad programs to qualify, disability of parent, and many more. We will be submitting written testimony with some recommended changes to further reduce the burden on families in the areas of absences and seeking approved activities, self-employment, to name a few. We will also be making some recommendations to improve systems within EEC and to really address the lack of resources available to providers to include and appropriately care for children who have special needs, especially school-age children. So we look forward to submitting the written recommendations on that. I did just want to speak quickly to follow up on a comment I made in chat, and also that I believe Donna spoke to earlier, that we really strongly, highly encourage EEC to allow the field to review the policies and procedures before they go out for implementation, to put together a provider working group that For Kids Only After School would be happy to be involved in, because this is where the true change for families will take place. If the policies and procedures don't go along with the intended changes of the regulations, then we are not going to meet our goal of being more family friendly. So thank you again. We look forward to continuing this work together. And like I said, FK is willing to help in any way possible.
Thank you so much, Brianna. Again, if you would like to share your comments, you're welcome to do so. If you raise your hand in the reaction section, we'd be thrilled to call on you and hear from you. We have so many people on too that I'm seeing names of who have such good feedback for us and such expertise. So again, don't be shy to share your comments. And Maria, we'd love to hear from you. Oh, you're muted, Maria.
Still, just a quick comment. I just a lot of my own recommendations as an agency were already included in this conversation, but as a board member and as a field member, I just want to thank the department for the opportunity to attend this meeting. This is the most transparent and accessible meeting I have attended, and it feels like a changing culture, and I appreciate the willingness to work as a team. This is really refreshing and encouraging. So thank you, and it's obviously will benefit our families.
Thank you, Maria. So we'll do another call again. Anyone with a burning desire to speak, share comments, but then potentially we'll give you back some of your day. I will definitely stay on this call. So if folks would like to chat, we'll be here. But I want to thank you all for your comments so far. They've been wonderful. We've learned a lot in a short hour. But anyone else who would like to share, you're welcome to, again, raise your hand, and we'd be happy to call on you and hear from you. We'll wait a little bit. Maria, go ahead.
Sí, buenos días para todos. ¿Me pueden escuchar?
Sí, so we can hear you, Maria, and Andres
no
is
puedo
here.
Escuchar.
Sí.
Pues agradecer. Ok, pues nosotros las educadoras nos sentimos arduamente agradecidas por el gran trabajo y el soporte que tanto el Departamento de Educación como muchos líderes comunitarios pues nos han dado ese gran apoyo y soporte en medio de momentos difíciles como la pandemia. Pienso que el trabajo que se está haciendo para la propuesta prevalece en soportar la familia, es soportar un programa, es mantener un programa vivo, ya que si todas las familias que tienen necesidades especiales, situaciones económicas o ingresos de bajos recursos, el Departamento de Educación trabaja con ellos para soportar a los vouchers y a los subsidios, pues es un gran trabajo que junto a nosotros, los educadores, nos mantiene de pie. Así es que gracias por su apoyo y bendiciones para todos.
Gracias, Maria. We'll ask for a moment for one of our interpreters to come to share.
Gracias a usted.
Gracias. Andres or Martha, if you could share what Maria shared with us, that would be wonderful. You may have to enter the global room for the original audio. Oh, Kim is saying that you did hear the interpretation, so wonderful. That's great. Thank you all. All right. So again, reaching out if anyone else would like to share some comments. Thank you for all of you who did so far. Be happy to hear from you. You just need to raise your hand. Since I'm seeing no other people raising their hands, I'm going to invite Commissioner Kershaw back. to say a few words, and I just want to express our gratitude for your time today, for sharing your expertise with all of us, and sharing your comments. We really appreciate it. Commissioner Kershaw.
Thank you, Eugenia. You did a great job, and we're so grateful for all your participation and your comments and sharing your thoughts. We heard a lot of stuff about dual authorizations, self-employment, how we treat income, how we make sure service need is really organized to support our families' true path to economic mobility, how we can make it easier for families throughout the process, and make sure that we're aligning in terms of documentation and what needs to be reported. And we really are taking copious notes. We're grabbing what's from the chat, we're hearing what you're saying, and we expect to be able to make at least some revisions to the regulations to reflect all of your comments. I also really appreciate the idea and the volunteering to create a working group to help us think through the policy and make sure if we issue that in the back of a room and miss aligning that policy. So for those of you who are working every day on the front line, and it should include our providers as well as our families in terms of their experience. So we will take that suggestion to heart and figure out the best way to make sure that we're developing those policies transparently and in collaboration with those of you on the front lines doing the work and experiencing the system every day. And the other thing I guess I would just also say is that this is going to be a journey, you know, so we're going to get some things right the first time around, like in this current revision of the regs, the next vision of the policy, but we're committed to kind of the long term. So even if there's things we don't get right in the first phase, we can continue to work on those. We can continue to update our IT systems to make sure that they're as easy and accessible both for families and for providers. So there's a lot of big, complicated moving parts to trying to get to where we want to go in the transformation. So thank you for being on this journey with us and for sharing your feedback and comments today. We can't get better if we don't hear from you about what you're seeing every day and what the families you work with are seeing every day too. So just really grateful for your engagement and just recognizing our board member, Maria Muller too. I think the board and the agency is really committed to this value of transparency, and they are joining with us on making sure that we're doing this in a way that is in touch with the experience in the field. So thank you for being here, Maria, and for your comments and support for this work going forward at the agency. So we look forward to continuing to engage you. And, you know, I know it's hard that it couldn't be really a dialogue, but hopefully that's something that we can do more in terms of working groups as we go forward. Christine McGrath, who put her email in the chat, is receiving any other additional written comments. If this was an uncomfortable format for you to share your thoughts, please share them in writing with her or any of the other EEC staff who are on here today. So thank you again for your partnership and thank you for being here.
Thank you, Commissioner. And again, thank you to all of you for joining us today, providing your comments in the chat, verbally today, or sending us an email to share your feedback with us. Next steps, just so you all know, look out for an email from me to share details. We will be posting the videos of this, both in English and in Spanish. I'd like to thank our amazing interpreters who've been fantastic for this whole session, Andres and Martha, who've been helping out in Spanish, and our ASL interpreters, Carrie and Julie, who've done a wonderful job throughout. So we'll make that video available, and as suggested in the chat, we'll share out the slides for you to see them as well. But thank you for all your words and sharing your feedback with us today. And you're welcome to head on to other things today, but I will stick around in this call to be around if anyone else has a thing for us. Thank you.
Thanks, Eugenia. Have a good day.
Thank you.